Heart valve repair is a surgical technique used to fix defects in heart valves and valvular heart diseases, and provides an alternative to valve replacement. Without further specification, it refers to native heart valve repair, rather than repair of an artificial heart valve. General techniques. Valvuloplasty. Valvuloplasty is the widening of a stenotic valve using a balloon catheter. Types include aortic valvuloplasty in repair of a stenotic aortic valve, mitral valvuloplasty in the correction of an uncomplicated mitral, valvulotomy. Main article, valvulotomy. Commissurotomy of cardiac valves is called valvulotomy. Bivalve. Mitral valve repair. Mitral valve repair is mainly used to treat stenosis, narrowing, or regurgitation, leakage, of the mitral valve. Aortic valve repair. Aortic valve repair is a surgical procedure used to correct some aortic valve disorders as an alternative to aortic valve replacement. Aortic valve repair is performed less often and is more technically difficult than mitral valve repair. There are two surgical techniques of aortic valve repair. The reimplantation technique, David procedure. The remodeling technique, Yacob procedure. Tricuspid valve repair. Tricuspid valve repair is used to correct tricuspid regurgitation. History. The first two percutaneous ultrasound-guided fetal balloon valvuloplasties, a type of in utero surgery for severe aortic valve obstruction, were reported in 1991.
Please subscribe and thanks for watching.